with Dr. Siegfried Kreis about pain management in the hospice setting. We've talked so far about some of the causes and the different kinds of pain and how the interdisciplinary team in hospice can assess these different kinds of pain and methods of treatment. We're going to be talking in this final segment about some other considerations in how we manage pain in the hospice patient. Dr. Kreis, what do you have to say about that?
Well, yeah, as we've been talking, it's so important for us to treat pain, because if we don't treat pain effectively, then the patient, number one, doesn't optimize quality of life. It's difficult to have quality of life, and as we discussed, it's difficult for a patient to achieve any other goals during the terminal phase of their disease, or the last days, months of their life. Unfortunately, there is a lot of problems in managing the pain because of some myths that exist. I think about 4 different myths that I deal with, the hospice team deals with in managing pain, and it's important for us to educate whether it be healthcare providers or the lay public about some of these myths to help overcome them. One myth is the myth of addiction. Patients and sometimes family members feel that if they actually take a narcotic, they'll become addicted to the pain, or addicted to, to the medication, and that's absolutely a myth. We understand that if a patient takes a pain medicine because they're in pain, they will not become addicted. So that's one myth we struggle with in our treating these hospice patients. Another myth is the myth of weakness, and that myth is when a patient feels like if they take a pain medication, they're succumbing to the disease, they're weak, their faith is not strong enough, their character's not strong enough, so they say, no, I will not take these pain medications. And that's very unfortunate, and it takes a lot of counsel and education that it's important for that we find it's important to treat that patient in his pain or her pain.
It actually frees them up to use their strength of character for other more important things.
Absolutely, absolutely. Another myth is the what I call the myth of misperception. And as we discussed earlier, a patient's pain is what that patient self-reports their pain is. It's their perception of the pain. It's not the provider, caretaker perception of the pain. So if a patient says on a scale from 1 to 10 that their pain is a 10, well, it is in fact a 10. Unfortunately, there are myths amongst physicians, nurses, caretakers alike that it's, for example, be my interpretation of what the pain is for that patient. If the patient says it's a 10, but I think it's a 3, well, I'll treat them as if it was a 3. So that's a difficult hurdle that we need to overcome and provide education as well. Finally, there's a myth I call the myth of medication failure. Many patients feel like if they take a medicine early on in their course of their disease, later on as disease progresses, there won't be a medication that will be able to effectively treat their pain. And as we discussed earlier, there are many different medications to treat pain, as well as there are many routes of delivery. There's oral, there's sublingual, there's topical, subcutaneous, intravenous, rectally. So in today's age of medicine, we have many medications, many ways to deliver those medications, and it is very rarely that we cannot provide comfort to a patient regardless of the stage of disease, whether it's early on or in delays. And one other barrier that's not related to pain management that we try to address is the late enrollment, if you will, of patients into hospice. Early on as the hospice movement started, most patients did not get onto hospice until the last day or two or week or so before they would pass, because of the thought or the belief was that hospice was for those just in the last couple days. Well, actually, hospice is far greater than that. It is for patients early on in their terminal course of their disease. So we are trying to educate families, the public, about the benefits of getting a patient onto hospice early on in their disease. And that way, we believe that patients can have more quality of life because their pain is controlled, they can have more dignity, and we can provide the family support that is needed. The goal of hospice is probably best stated by Hippocrates, who many years ago, before modern medicine, said, "It is important to cure sometimes, to relieve often, and to comfort